Chapter 14, Students with Severe and Multiple Disabilities. Individuals with severe and multiple disabilities include those who have two or more concomitant or simultaneous disabilities, and the combination of the disabilities cause severe educational needs that may not be accommodated in typical educational settings that serve students with one disability. Individuals with severe and multiple disabilities require ongoing and intensive supports to access and participate in the educational and community environments. So some characteristics of students with severe and multiple disabilities include limited speech or communication, limited or difficulty in physical mobility, tendency to forget basic skills when not used, or difficulty with generalizing skills from one situation to another situation. Although these students experience limitations and may have complex needs, they are capable of learning with the support and can acquire necessary skills for daily living and interaction with others. Promoting inclusive practices has been a major goal in the field of special education over the years. However, students with severe and multiple disabilities typically receive their instruction in more restrictive or separate settings. To promote the inclusion of students with severe and multiple disabilities in general education settings, it is important for educators and other professionals to provide appropriate accommodations and modifications so all students can access the general curriculum. Effective practices to implement an inclusive classroom may include, but are not limited to, UDL, or Universal Design for Learning, which incorporates evidence-based practices to accommodate diverse learning needs or diverse learners. Classroom environment modifications. This allows for special equipment and promotes the student's overall ability to function within the classroom. Differentiated instruction is also an effective strategy to implement in an inclusive classroom, as well as cooperative learning, peer-mediated instruction or peer tutoring, and the use of assistive technology or augmentative and alternative communication. So for individuals who experience multiple sensory, physical, cognitive, and communication impairments, the use of augmentative and alternative communication devices, also known as AAC devices, allows them to establish functional communication and to achieve daily communication goals to meet their communication needs. Most important, students with severe and multiple disabilities can learn to achieve when given the resources and the opportunities to do so. The IEP team must work collaboratively with the parents or the family members or caregivers to establish appropriate goals for their students without underestimating their capabilities. So it is important for the IEP team to identify what the student should accomplish within the time they are receiving special education services and have enough time to learn and make adequate progress, considering that it may take more time for them to acquire new skills. Students with severe and multiple disabilities may require unique accommodations and modifications, as well as creative and flexible instructional approaches to help provide them with meaningful learning experiences and to encourage their participation. So it is important for educators to provide students with meaningful learning opportunities that capitalize on their strengths, their abilities, and to strengthen their skills to become more independent as well as more engaged with other students within the classroom and within their community. To apply what you learned in Chapter 14, review the section Assessment of Students with Severe and Multiple Disabilities, pages 432 through 435, and reflect on the following questions. What is the purpose of assessing students who have severe and multiple disabilities when their eligibility for special education services is not in question, given the severity of their disabilities? And why are norm-based assessments problematic for students with severe and multiple disabilities? Then review the section, How Learners with Severe and Multiple Disabilities Receive Their Education, pages 435 through 440, and reflect on the following questions. In what ways does research regarding educational practices support changes in IDEA regarding access to the core curriculum? And what are concerns related to using paraprofessionals without appropriate training to support inclusive practices? So the purpose of this activity is to encourage deeper reflection on the content presented in Chapter 14, and it's not a required assignment.